We reported on the raids in Towson, Owings Mills, and nationwide, some going back as far as 2011. Federal agents shut down clinics and alleged pill mills and confiscated records, all part of the opioid crisis crackdown.
I'm scheduled to spend 87 months behind bars.
Dr. Lonnie Joseph Parker of Texarkana, Arkansas, talked to 11 News Investigates in October, days before he self-reported to federal prison. He says the Drug Enforcement Administration targeted him and claimed he was overprescribing pain medicines and running a stealth pill mill. He says all he did was try to help his patients.
Right now, no doctor in the United States of America can safely treat any medical problem with any controlled medication without the potential of being arrested, convicted, and sent to prison under the criteria that the DEA is using to indict and try doctors.
He has talked to at least 3 Maryland doctors concerned about their own medical practices. His message to those physicians:
you must choose between doing what's right for your patient and doing what keeps you safe. The only safe thing to do is not prescribe any controlled medication until these witch hunts, this inquisition, stops.
The feds deny this is a witch hunt or inquisition. Justin Wood is a DEA diversion manager.
We're the part of the DEA that focuses on the entire supply chain of controlled substance pharmaceuticals. So from the point of manufacture through the wholesale distributors, all the way down to the hospitals, the pharmacies, the medical offices, that's our world that we try to regulate.
He says the objectives are protecting communities and saving lives.
But we also want to ensure there's a legitimate and uninterrupted supply of legitimate medications for patients throughout our nation.
The latest figures released at the beginning of this month by the Centers for Disease Control and Prevention show approximately 125 million opioid prescriptions were dispensed in 2023. However, 8.6 million people ages 12 and older reported misusing prescription drugs. 5 million reported having a prescription use disorder. And between 1999 and 2022, approximately 294,000 people died from overdoses involving prescription opioids. Assistant U.S. Attorney Alex Levin tells 11 News many of the criminal investigations begin following an overdose death. One main question: who supplied the pills?
We just follow, where the evidence leads on the pills, and if it leads back to a street dealer, if it leads back to a doctor, that's where the target is.
Some patients suffering from chronic pain say they've been swept up in the crisis. They continue trying to find physicians who can effectively treat them. This woman says exercise and acupuncture didn't work. A physician prescribed opioids for her back and joint pain. She was on high doses, but then that clinic was forced to close.
The doctors have been shut down, so you're forced to find another doctor who then gets shut down. It's extremely disheartening to live in constant pain and constant fear for, is this doctor going to be shut down now? Am I going to be going through this long, arduous search again?
Another patient tells us Lyme disease caused his severe joint and back pain.
I flourished once my pain was controlled.
He says at one point he was prescribed high doses of oxycodone and hydromorphone. The opioid crisis crackdown forced his doctor to shut down. He went to another who eventually voluntarily retired, and then a third severely cut his medicines.
It was tremendous, tragic, horrific, and unlike nothing I had ever experienced physically and psychologically. I wound up engaging in suicidal ideation. I also subjected myself to electroshock therapy. The hope was that that would break the all-consuming depression that I experienced after the forced taper.
He does not think his current pain management is adequate. The female patient, now on her 4th doctor, says her medications were also severely reduced.
It's not great. I'm not where I was before. I mean, I suffer on a daily, hourly basis. I functioned better before, but I am functioning. It's just, you just hang in there.
The national campaign to protect people in pain and other advocacy groups want changes in public policy.
What I see is an avalanche of people who are reporting that their doctors are leaving the practice of pain medicine and they can't find anyone else to treat them.
The group does not think doctors should have become targets and has filed complaints with the Department of Justice and the Department of Health and Human Services, claiming civil rights violations and fraud.
The reality is that doctors prescribing to their patients did not create and are not sustaining the U.S. opioid crisis.
Opioid prescriptions written by doctors and filled by pharmacists remain on the radar of the Department of Justice. But much of the focus now has shifted to combating synthetic opioids like fentanyl.
The fentanyl is a crisis unlike any other drug crisis we've ever seen.
The DEA's Justin Wood shows how 2 milligrams on this pencil point is enough to kill someone. He says 70% of the fake pills seized off the streets are laced with fentanyl.
That's the scary thing. People are assuming that they're buying a Percocet or an Adderall or some other pharmaceutical controlled substance. These pills are pressed to look exactly like legitimate pharmaceuticals.
I pull out the most recent statistics for Maryland. In the past 12 months, we've had almost 1,900 overdose deaths, and over 1,500 of those were fentanyl related.
Numbers the recently established Maryland Fatal Fentanyl Task Force is trying to reduce by enforcing drug laws and convicting those who cause overdose deaths. For 11 News Investigates, I'm Barry Soon.